Did you know that if you have ADHD, you are 50% more likely to develop type 2 diabetes later in life? Part 2. If you are someone who has ADHD, then you undoubtedly have issues with executive function, or you could just say you have executive dysfunction. And that means you have difficulties planning, organizing, carrying out tasks. Maybe that's making sure that if you have a job interview the next morning that you have a shirt and tie ready, and if that shirt needs pressed, you've done that. Making sure that you leave yourself enough time to do homework or complete some work-related assignment or task or report. Or maybe that's even making sure you remember to refill your prescriptions, like your ADHD prescriptions. Now, if you have executive dysfunction, you ain't good at planning stuff. You ain't good at organizing stuff. You're sure as heck not good at carrying out tasks. And that's especially tricky for those with ADHD, because if you're trying to prevent developing type 2 diabetes later in life, you probably didn't plan your snacks for the day. You probably didn't plan your meals for the day. It also probably means that when it's time to get a snack or have your meal, you're gonna go for something convenient. And those convenient foods are more often than not ultra processed. And a recent study from the Journal of American Medical Association followed 100,000 non-diabetic individuals over the course of 6 years and found that those who had a high level of processed foods in their diet, or their diet was composed of a high level of processed foods, and that was only 22% of their daily energy intake, they had a significantly higher risk of developing type 2 diabetes. And if you remember from my previous video, we talked a little bit about glycemic index. And the reason that these people tended to be more prone to developing type 2 diabetes from these convenience foods, from these processed foods, was because the processed foods have a very high glycemic index. A study from 2022 from the International Journal of Epidemiology looked at 18 separate studies that covered 1.1 million different individuals and found that there was a 31% increase in likelihood of individuals developing type 2 diabetes if they were consuming processed foods or ultra-processed foods. And even further studies have shown that in the pancreases of those with type 2 diabetes, they have an increased rate or increased occurrence or incidence or whatever you want to call it of titanium dioxide. Now, titanium dioxide is a nanoparticle that's used in the processing of ultra-processed foods. It helps achieve desirable colors. Why would this be a problem? Well, it's occurring in the pancreas. What does the pancreas do? It makes and secretes insulin. Weird.